Welcome back to Meds Made Easy. My name is Tarun Verma. Today we're going to talk about Alprazolam, but you probably know it better as Xanax. It's everywhere in pop culture. You see it in movies and TV shows, but it's not something to be trifled with, okay? So it is a very dangerous medication if you don't know what you're doing with it. Let's kind of go over the whole gamut of it. It's generally used for general anxiety disorder linked to depression and panic disorders as well. Now you can use it off-label for a lot of different things, but we won't go into that. We'll kind of keep this video kind of short. There's a different video we have on benzodiazepines as a general class, so that's Alprazolam is a type of benzodiazepine, so go to that video if you want like the more overview stuff on it. I'm going to kind of go into the specifics of what this one really is. Let's see here, the dosages range anywhere from like 0.25 to 2 milligrams. You can take it several times a day, 3 to 4 times a day. It just depends on your doctor and how they want you to take it for what you're taking it for. And that's the immediate release. The extended release, you generally only take 1 to twice a day tops. The immediate releases kick in about 1 to 2 hours. You'll start to feel it. And then the extended release, you'll start to feel it in about 4 hours, a really good effect on it. And that's what separates this one from all the other benzodiazepines out there. This is a little bit more quick acting. Kicks in pretty quickly and wears off pretty quickly too, which is why you kind of have to dose it several times a day to kind of get the effect you want. If you ever try to get off this medication, you need to taper off, take less and less and less each day, because your body tends to develop a dependence to it, and if you just cut it off cold turkey, you're going to end up with withdrawal symptoms. You don't want that at all. Let's see here, there's a black box warning. Do not take this with other opioids because it causes reduced respiratory depression, meaning it slows down your breathing, slows down your whole respiratory system, so you just now don't breathe much. And so that's dangerous, because if you take too much of this stuff, a lot of people will OD on opioids while they're taking Alprazolam or other benzodiazepines, and then they don't ever wake up. They just fall asleep, never wake up. And then also at the same time, people party with these drugs. So if you're out drinking and then you take a couple of Vicodin and then you're also on some Xanax at the same time, you're gonna get like a really high, a big high, but it puts you at a risk for dying because you're layering all these chemicals that shouldn't be layered together. And opioids and drinking already cause a huge problem, and then where Xanax comes in and becomes so lethal is that it inhibits your gag reflex, which means if your body ever wants to throw up because it's in OD mode, right? Because if you ever overdose, you hit toxic levels in your body of anything, your body will just, what does it do? It throws up, right? If you drink too much alcohol, you throw up, right? You eat too much bad Chinese food, you throw up. That's not a knock on Chinese food. I mean, like any food. You eat too much Mexican food, any food, you'll throw up. Point is, if your body ever hits that limit, it'll throw up. But Xanax will prevent you from throwing up, so that gag reflex won't really hit in. So if you ever do throw up, your body won't respond the right way, and especially if you're sleeping, you'll sort of choke and die in your sleep from your own vomit, and that's a terrible way to go. We see it all the time in a lot of these like drug documentaries and things like that. So watch out for that. It does go through your liver, so make sure your doctor's aware of any other medications that are going through your liver. It's pregnancy class D, which means you do not take it when you're pregnant. Just do not. It affects the fetus. Even the fetus can have like withdrawal symptoms once you deliver, which is scary stuff. So you don't want, your doctor should obviously know, but you shouldn't even try to be sneaking in Xanax if you're pregnant or anything like that. That's just not safe, and that's just, it's not cool, people. It's not cool. It is present in your breast milk. However, there's this thing called RID, relative infant dose. So as long as you are within a certain threshold of like how much percentage of Xanax shows up in the milk, as long as it's under a certain level, it is deemed to be safe scientifically, medically. But again, these are questions that you should have for your doctor. Your doctor should be testing your breast milk if you need to be on Xanax while you're breastfeeding, to make sure your child isn't getting too much of this stuff. Because again, you don't want to cause those problems, because especially for a baby that's just developing their brain, for them to kind of develop dependence to Xanax is a terrible and frightening thing. You don't want that scenario. I'll put a list up of medications here, or sorry, it's not medications, side effects. A lot of different things can happen on this medication. When you first get on this medication, you really need to try it for yourself in the evening when you're not going anywhere and see how you feel on it. A lot of people cannot operate things when they're on this medication. Over time, as you develop some tolerance, people feel comfortable taking Xanax and going to work and things like that, and that's okay and fine. But in the beginning, you do have to see, because it does sedate you, right? It puts you down. That's how it calms you down whenever you have a panic disorder or a panic attack or anything like that. It calms you down. So, let's see here. Beyond that, I never really explained how it works. Man, it's complicated. It works on your GABA receptors in your brain, and that's kind of how it reduces. Essentially, it's a downer. That's the best way to kind of put it in layman's terms. So, again, if you have anxiety of any kind, it brings it down. It brings you completely down. And also at the same time, when we bring you down, what does that mean? We're kind of making you sleepy. So that's why you have to watch out for this. Or even if you don't take opioids and you drink on Xanax, you're going to get that profound knockout effect where, you know, half your alcohol or something like that, right? So if you normally drink 10 beers and it makes you pass out, you'll drink 5 on Xanax and it'll make you pass out. But that doesn't mean do that, because that's dangerous stuff to do. Again, if you ever need to throw up or do anything like that, it'll prevent your gag reflex from happening. And that's just not the sole reason for it. There's a lot of other complications that can happen when you pair other downers with each other, right? When you layer up your downers, you'll get a high, but then the side effects that come with it are you just don't want it, people. It's just not good stuff. So I'm not gonna keep harping on that part. I think you guys get that. I think that's about it, guys. So again, if you have any questions, leave it in the comments below. Give us a like on the YouTube page. Show us some love. Spread the videos around. We're just trying to do good with these videos. And we'll see you next time on Meds Made Easy. Bye.